If you could please save your questions until the end, unless, of course, Emily stops at some point and requests some interaction. We just want to make sure that we're able to get through all the material in the allotted time. So I am going to go ahead and pass the controls over to Emily so that we're able to view her presentation. So it'll be just one moment while I do that. Okay. We're able to see your screen now.
Great. Wonderful. And can you hear me okay as well?
Yep.
Okay, fantastic. Well, good morning, everyone, and thank you for allowing me to be here today to share some of the research and information that we have been working on over the last couple of years. I have a lot of material to present, and I will pause a couple places and ask for questions, and then hope near the end of the presentation that we can maybe engage in a little bit of discussion as we think about the implications of some of the information that I'm going to present. But I would also suggest that as we're going through, if you want to use the chat feature to share any questions kind of as we go, we can run through that as well when we get to a good stopping point. So today, I'll provide an introduction to the benefit cliff, talk about the model we created to examine it in Ohio, present what that cliff looks like for a few different family compositions, and talk about how you might be able to help people facing this situation. So let's get started. I have probably met some of you, but not all, and here I am. My name is Emily Campbell. I'm the Associate Director and Williamson Family Fellow for Applied Research at the Center for Community Solutions. We are a nonprofit, nonpartisan think tank with offices in Cleveland and Columbus. And here you probably see a very familiar picture with the arrow pointing right to where I work in the Bulkley building, just a couple of doors down from the United Way building in downtown Cleveland in Playhouse Square. So for over 100 years, the Center for Community Solutions has worked to address health, social, and economic conditions that impact low and moderate income Ohioans. Our focus is on health and social service policies, and here you see our mission. So we focus primarily on policy analysis and advocacy, applied research, and communication. We've been called a think tank with muddy boots because we do high-quality, in-depth analysis, but we also engage directly with policymakers to try to affect policy change that can improve the lives of Ohioans. For many years, we've worked closely with United Way and partnered with 211 on a number of different projects. So, am quite familiar with the great work that you all do and the important role that you play in helping low-income Ohioans with their needs. But today, I will be talking about the benefit cliff and have built up some expertise over the last couple of years on this issue. So for several years, we have conducted research on the benefit cliff in Ohio, and it began at the request of several partners in counties surrounding Cuyahoga. And one of the real leaders in this work was United Way in Geauga County. They had found information from Indiana and wanted to know if there was something similar for Ohio. There wasn't, so we created it. And our first information was released in 2015, and it did look at Geauga County. After working collaboratively with them and some others and service providers to develop a relatively realistic model, we published our initial analysis about 2 years ago, and we called the benefit cliff a roller coaster and looked at what the path from poverty to prosperity might look like for a family of 1 adult and 2 children in each of Ohio's 88 counties. And we're continuing to use our benefit cliff model as a frame to examine the possible implications of policy decisions. For example, last year during Ohio State budget deliberations, we looked at how freezing Medicaid expansion would impact working families and found that it would make the benefit cliff worse. And as we know, those policies were not enacted in Ohio, so we like to think that our work helped make the case for for maintaining things as they were and not enacting a policy that would be harmful for working families. So we've updated our model to cover the whole state, and I'm happy to share our findings with you today. But first, I want to talk a little bit about what the benefit cliff is. It's a difficult concept to describe, and this is one of the simplest explanations I've been able to find. It's adapted from work by the Colorado Women's Fund. So in the United States, federal and state governments provide a suite of public benefit programs designed to support individuals living at or near poverty to achieve a basic standard of living. Low-income families qualify for work support benefits that help cover the cost of basic necessities, and I know that you all help many families connect to the benefits that they are eligible for. However, as earnings increase, families begin to lose those benefits. And in the best case scenario, earnings increase, but the family is only marginally better off. In the worst case, parents can work more and earn more, yet their families end up worse off financially. The result is that people can earn more without improving their overall financial situation. For most families, a pay increase is cause for celebration. A raise means they have more money in their pockets at the end of the month, and the extra can be used to fund a family vacation, pay down debt, or provide a cushion in their monthly budget. However, for some families earning low wages, a raise means that they will have less money in their pockets at the end of the month. And in some circumstances, even a small increase in income causes a drop in the public benefits a family can receive, effectively increasing their expenses and hurting their ability to make ends meet. And we will explore this phenomenon in more detail. The safety net is needed because working for low wages, even full-time, doesn't provide enough income for families to meet their basic needs. And here you can see some of the types of benefits, which are often called work supports, that families, which help families make ends meet, things that I'm sure you are all very familiar with. So the federal benefits include Supplemental Nutrition Assistance Program, or SNAP, for food, and Public Housing and Housing Choice Voucher Program, or Section 8, for housing. Medicaid, as you know, is a federal-state partnership to provide health coverage for low-income families, and most states, including Ohio, provide some form of child care assistance for working families, which ensures that children are well cared for while their parents are at work and can be a huge help to a family's finances, as our model will show. And ideally, these work supports would be there for anyone who needs them and provide an adequate level of support for a family to make ends meet without assistance from anywhere else, such as friends or family, faith-based groups, or philanthropy and charity. However, government's resources are limited, and we would need to raise taxes significantly to produce enough money to cover everyone. So scarce resources are targeted to those most in need. So instead, benefits are means tested so that work supports phase out and drop off as income increases. And simply put, as families earn more, they qualify for less. And that makes sense. As people earn more, they probably need less. Some benefits phase out, getting smaller and smaller as someone earns more until they dwindle to nothing. Other times there are hard and fast eligibility criteria that come on suddenly. And the intent of means-tested benefits is to ensure that scarce resources are used for those most in need. And most of the time they function as intended and provide important support to help families make ends meet. However, there are instances when even a $1 increase in annual earnings results in the loss of a benefit worth hundreds of dollars to a family. And that's because of benefit amounts and eligibility criteria. So again, ideally, benefits would phase out gradually. As families earn more, they need less, they receive less, and the road would rise to meet them, so to speak, so that whatever they lost in benefits would be made up in earnings. The phase out would look something like this, a gradual decline until the family was self-sufficient. Public housing and the housing choice vouchers basically work like this. A recipient must pay 30% of their income for housing so that the benefit decreases as income increases. And as you'll see in our model, by the time a family no longer qualifies, they're earning enough that they can afford to pay for housing themselves. But unfortunately, that's not how many programs are designed. Some benefits have a hard cutoff, so they disappear when a family still needs them. And when that happens, it creates a cliff. Medicaid is a prime example of this benefit design. The income eligibility criteria are strict, and you either have coverage or you don't. There's no phase out at all. Childcare also creates a large cliff, although in most states, including Ohio, co-payments are required before a family earns too much to qualify at all. So it looks more like this, a slope which is abruptly cut off. SNAP is intended to be a slope where the benefit decreases as earnings increase, but it happens too quickly for many families, so that poor working parents rightly feel that food is being taken off their table as they earn more money. The Indiana Institute on Working Families has said that most often the single greatest barrier to self-sufficiency for low-income individuals is the cliff effect. The unintended consequence of this design either leads to a disincentive toward economic mobility or leads to a situation in which the parent or guardian is working harder but is financially worse off. And I'm sure that you hear frustration from many of your callers because of these circumstances. So we examine this economic phenomenon in detail by creating a benefit cliff model, which I'll talk about next. So our model begins with a basic monthly budget, which is different depending on the composition of the family. We could have a whole session about how these are calculated, but let me just say that in order to determine the basic budget, we rely heavily on the living wage calculator from MIT, which provides different estimates for each state. Data on the cost of transportation and other necessities comes from the Bureau of Labor Statistics Annual Consumer Expenditure Survey, and we get health coverage amounts from the Medical Expenditure Panel Survey, or MEPS. What we're looking at is a basic budget. For example, the food expense is based on the USDA's low-cost food plan, and other necessities is limited to apparel, housekeeping supplies, which are things like laundry detergent and cleaning and toilet supplies, and personal care products. It does not include telephone expenses, it does not include educational expenses, and no medical expenses beyond just insurance premiums are covered in this basic budget. For taxes, we look only at federal payroll taxes and any federal and state income tax which would be withheld from the paycheck. And we limit it this way because we're ultimately interested in what a family has left over at the end of the month. So we don't take a look at things like the earned income tax credit or the child tax credit that might come for a family at tax time once a year. We're thinking about month to month and what a family needs to make ends meet. As you know, Ohio also has state and local income taxes, so we include those as expenses as well. So here is one example. It is the monthly basic budget for an Ohio family of 3 with 1 adult and 2 children. And they would need to earn $3,090 per month in order to afford the basics without any assistance, plus taxes. And this is what we consider the break-even amount. So it would be an hourly wage of around $17.80 per hour. And for this family, childcare is the largest expense, as it is for many working families with children. And similar to what other studies have found, we found that earning enough to cover the basic budget, our families would be well above the official poverty threshold. In fact, a family of 3 with 1 adult and 2 children would be earning 181% of the federal poverty level. And as you know, many public benefits cut off eligibility around 130% of the federal poverty level, so you can see why the benefit cliff is an issue. Our basic budget is, however, below the median income for Ohio, which is shown there in gray. And there tends to be general consensus that the official measures of poverty don't accurately describe which families might be struggling. So here you can see several other estimates of what a family might need to make ends meet. We have included the living wage calculated by MIT and the self-sufficiency standard, which is defined as the amount a family would need to earn to make ends meet with no assistance from friends and family. And because our basic budget is so constrained, it shows up there somewhere between the official poverty threshold and these other measures of self-sufficiency and economic independence. So because people don't have enough money to make ends meet, they receive public benefits. Some benefit cliff models look at the value of the benefits received, but we look at how the benefits reduce a family's monthly expense. So if a family receives SNAP, for example, it means that part of their food costs are covered, and it means more money is left over for them at the end of the month. So before I dive into what our model shows and what the cliff looks like in Ohio, I wanted to pause and see if there were any questions at this point. I'm going to give you a few seconds. All right. So hearing none, let me continue on. There we go. So as we put this together, we of course had to make some assumptions, and some of them are more realistic than others. Here you see them, and I'll go through them very quickly one by one. The first assumption we make is that the adult works full-time, 40 hours per week for the entire year. We know that people working for low wages often don't have full-time jobs, but for the purposes of this model, we decided to just look at full-time work. We also assume that the family receives all the benefits for which they qualify. We know that this is a challenge, especially when it comes to housing benefits, that there are long waiting lists for certain housing benefits. But again, we wanted to try and make a model that could be used to understand families in a number of different circumstances. We also assume that they are able to find subsidized housing and appropriate childcare, which accepts their subsidy. We know that this is a challenge, and we know that many of you with 211 First Call to help people connect to those particular services. And we also assume that as soon as they earn too much income, the benefit disappears. So the moment they're over income eligibility, the benefit is gone. We don't think about redetermination processes or anything like that. We just kind of go with the most simple thing we can. So one additional assumption has to do with child care assistance. So as many of you know, in Ohio, you must earn a very low wage in order to initially qualify for child care. But once you're in, you can stay in even as your income increases. So we assume that this family qualified when their income was low, and they're able to maintain that assistance as their income increases. And again, we know that this paints a rosy picture, but it does help us understand where some of those challenge points may be for Ohio families. So in a moment, I'll begin to share our findings and walk through what the cliff looks like. But first, a brief note about how to read the charts, and they are all formatted the same. So the hourly wage that the person is earning is listed at the top. And we begin at minimum wage, which is $8.15 an hour in Ohio. And then we go up in $1 per hour increments. Here on the side, and the blue snaking lines, which you'll see in a moment, represent the amount that's left over each month after paying for the basic budget. And it corresponds to the amounts that are listed here on the left. The break-even line is shown in bold gray, and keep in mind that we are looking only at working full-time year-round. If that blue line is in this top part, above that gray part, it means that the family is able to meet their basic expenses and they are able to make ends meet. Anything below it means that the family is underwater and they don't have enough income to pay for their basic expenses. So that means that they're going to have to dip into their savings, borrow from friends and family, or figure out something else in order to make ends meet. So the first example we're going to look at today is a family of 3 people, 1 adult and 2 children. And here is what it looks like. You can see that they start off unable to make ends meet even with full-time work. Their income rises and they are breaking even and even a bit ahead, and then they start to have a co-payment for childcare and they fall behind again. So it goes up and down as they move their way up in hourly wages. But let's take a closer look. Even working full-time at minimum wage, this family is underwater. That is even with benefits covering part of the cost of food, housing, childcare, and getting health coverage through Medicaid. They're still not able to make ends meet. But pretty quickly, they get above that break-even line. The rise is slow, but it's enough. And at $8.50 per hour, this family is earning enough to pay for all the expenses in the basic budget with $16 whole left over at the end of the month. But they're probably still struggling because, again, our basic budget covers a limited bucket of other necessities. Things continue to improve as they move up to an income to $9.50 per hour, but then child care co-payments begin, and it pushes them back down below that break-even line, and they can't make ends meet. And this is the first cliff they encounter. So even though they're earning more money, they would be worse off or feel worse off, and perhaps wonder why things are so difficult. But they slowly climb back up, and they're starting to have more and more left over through $12.50 per hour. But by $13.50, they're over income for SNAP, and they lose the support to help them with the cost of food, and so they encounter another cliff. The hits just keep coming because by $14.50 an hour, not only does the parent earn too much to qualify for Medicaid, but although they still qualify for HUD programs, because they are required to pay 30% of their income toward housing to receive the benefit, it loses its value and they begin to just pay their rent without assistance. Again, we're assuming that these are very savvy consumers. And as you can see, that cliff is wider. So it's not until they're earning more than $15.50 per hour that they get back to where they were when they were earning $12.50. And in practical terms, that's a big jump. Going from $12.50 per hour to $15.50 per hour, there's a good chance that person's going to need additional training, certifications, or education to move up that high in income. And it's the difference between about $26,000 per year and a little over $32,000 per year. But as you can see, they continue to climb until 1950 when they encounter the next cliff. And at that point, they are earning an annual salary of $40,560, and they're above 200% of the federal poverty level, so the children are no longer covered by Medicaid. Since this person is working full-time, we assume that they get health insurance through their employer at that point, even though we know that that is sometimes not the case. The only benefit they have left now is a subsidy covering part of their child care costs. But as income increases, the copayment for child care assistance increases, and it rises so quickly in Ohio that the copayment eats up much of their additional earnings as they continue to move up in income. And so at $26.50 per hour, they're paying more in a copayment than they would need to pay for child care directly, so they stop receiving that benefit. And after that, they're receiving no public benefits, so that every extra dollar earned is a dollar in their pockets. And as you can see, it's not just one cliff, but a series of cliffs that they encounter. And we know that people truly experience these cliffs, and it impacts their decision making. So what happens to their benefit cliff if we add another adult? So say that the parent gets married, but unfortunately that second adult is unemployed, so only one parent is working in this version of our model. And here's what their cliff looks like. Like the family of three, they start out underwater, but they encounter fewer cliffs along the way. And we've made a couple of additional assumptions for this family. So we assume that the non-working parent stays home with the children so they don't have to pay for childcare outside the home, and that the family only has one car, so they have the same transportation expenses as a single parent family with children. They start out way behind. With only one person working full-time for minimum wage, this family is deeper in poverty than a family of three, with an income that puts them at 68% of the federal poverty level. Their housing and transportation expenses are the same as a three-person family, and they don't have child care expenses. But adding that extra adult increases their food expenses and the cost of other necessities, especially apparel. There are no public benefits to help them with these other necessities, and the small increase they receive in SNAP benefits is not enough to cover their increased food costs. They start out more than $200 behind, and it's not until $12.50 per hour, or $26,000 per year, that they are earning enough to pay for even our basic budget. But for a while, things improve. And when it reaches the point that they would no longer be saving money by receiving a housing subsidy, they just pay their rent themselves, and it doesn't really cause a cliff. At $16.50 per hour, they have finally climbed above 130% of federal poverty, so they no longer qualify for SNAP, but at that point they're only receiving $46 per month, so they're able to make up the difference with their increased earnings. I should note that a family of two adults with both of the adults working full-time for minimum wage would be earning about this much, $16.30 per hour. But they would have added expenses for transportation to and from work for the second parent, as well as those significant child care expenses. But then at 138% of the federal poverty level, the parents no longer qualify for Medicaid. So they get two-person insurance through their employer, which costs about $250 per month according to that MEPS survey. And this is the first real cliff that they encounter. They're quickly able to make up the difference by getting another raise, and the only public benefit they have left is Medicaid coverage for the children. When that goes away above 200% of the federal poverty level, it causes a small dip, and the monthly premium for their health insurance increases from $250 a month to $331 per month. This is the amount that they are having to pay for health insurance. They keep getting raises and things keep improving. And remember that they're no longer receiving any public benefits. So this is what we'd expect to see. And there is one more small bump in the road as federal income taxes begin to be withheld from their paycheck. Remember that all along, federal payroll or FICA taxes and state and local taxes have been withheld. But when they hit the time when federal income taxes are withheld, it causes a small bump for them. After that, they keep all of their extra earnings. So again, that's a family of 4 with one adult who's working, one adult who's unemployed, and 2 children. And we often have been asked about a single adult, the sense that there's a lot less available for people without children out in the community in terms of public benefits. And so this is something that you probably note in your work every day. And our model certainly shows that it is the case, that there is much less available for a single adult. And in fact, here's what their cliff looks like. Compared to other families, there really are no cliffs. And in fact, a single adult working full-time for minimum wage is earning enough to cover their basic budget because their expenses in every category are lower. They don't have childcare, they're renting an efficiency apartment instead of a 2-bedroom, and they need less food and fewer other necessities than that family of 3 or family of 4. But even earning minimum wage, their income is too high for them to qualify for SNAP or for Medicaid coverage, even under the Medicaid expansion. And so the only benefit they receive is a housing subsidy. And pretty soon, they've hit that 30% of income that they need to pay to keep their subsidy is more than they can rent an apartment for on their own. But it really doesn't create a cliff for this single adult. And so after that, the person receives no public benefits, and the amount they have left over each month increases along with their earnings after taxes. So let's take a moment to compare all 3 of the scenarios that I presented. And remember, each of these families has one working adult. So here we see the cliff for a family of 3 with one adult and 2 children. Again, they start out barely underwater and they encounter several cliffs along their journey from poverty to prosperity. There are points where it would be a bad economic decision for them to accept a raise or work more hours, particularly at incomes below $30,000 per year. We add another adult and we have another line. The red shows a family of 4 with one working adult and one adult who stays home with their 2 children. Because of their higher expenses and very little in the way of additional public benefits, they start out far worse than the family of 3. And their biggest cliff comes when the parents lose Medicaid coverage and they have to purchase health insurance. But at higher incomes, above about $42,000 per year, they're better off than the family of 3 because they don't have those high child care expenses. Remember, someone is staying home with the kids. And finally, we look at the single adult who qualifies for almost nothing but has lower expenses. So this person starts out better off than our families with children and they stay there. And you can see that sometimes the rational economic decision is not what we might want for these families. And we've heard from many direct service providers in communities across the state and in some other states that low-income families are very aware of the fact that they can lose benefit as income increases, and they're making decisions accordingly. So in addition, research out of the Women's Fund of the Greater Cincinnati Foundation has found that even if people don't encounter cliffs themselves, it still has an impact. And they have some interesting recommendations about changes which could ease that impact. They have recommended things like sending a family a box of food and recipes similar to Blue Apron for a couple of months after they lose SNAP benefits, or even rewriting the notices that come from Job and Family Services to be more positive and say things like, you know, you've taken an important step on the journey to economic independence, rather than sending them a message that says, you earn too much, you getting kicked off benefits, and implying that they've done something wrong by earning too much and that they're taking away those benefits. So then we start to think about what can you do, or what can the community do to help people who are encountering these cliffs or getting close to them to think about what might be the best decision for their families. And so here are some questions that groups working with low-income families facing these situations may want to ask. So the reality is that if you want to move from getting by to getting ahead, you're going to have to leave the benefits behind eventually. And earnings history can impact the ability to get a higher paying job in the future. So this is actually one of the theories behind the wage gap between men and women, is that women don't have a steady increase in pay throughout their careers the way that many men do. So if someone refuses higher wages, they continue at a salary level where they would ordinarily have been receiving a regular pay increase. And one woman from that Colorado study I mentioned said, "You look like a $9.50 an hour employee, but you're really a $14 employee." And then there's a big difference between incremental and transformative change in the person's circumstances. But the place where you all and where 211 First Call for Help really comes in is this kind of middle blue piece and what other resources can help. So in this model, we're only looking at public benefits, those things that government provides to help people make ends meet. But we know that there are tons of other resources out there for people. And so someone who has lost their SNAP benefit still would be under income to qualify for food bank services, for example. So helping people figure out where they might be able to make up or to supplement their food in order to be able to make ends meet is going to be really important. And sometimes it's about thinking creatively and trying to help people perhaps decrease some of their other expenses, although doing so can impact some of their other benefits. So you have to kind of tread carefully. And a key question about how long will this hurt is something that families are going to need to think about. So if it's a situation where where the children are like about to go off to school, then their childcare expenses are going to decrease significantly anyway. And so losing that childcare benefit or having to pay more in that copay may hurt for a little while, but the family will be better off overall. We hear a lot, especially from women facing these situations, that kind of everyone goes off to school at the same time. So mom works on her degree or credentials to increase her skills and her earning ability, and the kids go off to school full-time, and it really frees up that time for mom as well as the money, and makes things a little bit easier for them. And something to keep in mind, especially in this environment, is the political environment. So many of these public benefits are under fire in Washington. We've heard proposals to turn Medicaid into a block grant program or change the eligibility. We have heard proposals from the president's administration and others to change the way that HUD housing benefits are given so that low-income families would need to pay even more in rent every month than that 30% of income. And so, there's it causes a lot of stress in low-income families to worry about what's going to happen if these things just disappear suddenly through no fault of my own. And then the ultimate question is, does this help the person move toward economic independence? So in general, and I'm sure you hear this from people all the time, people want to be able to make ends meet. They want to be able to be self-sufficient, to be economically independent, to really be in control of their own futures and get off benefits. They just have to figure out when it makes sense for them to do that. And so things like taking a job that has a clear career pathway where they'll be able to move up in income is really different than taking a job or taking a raise in the same job they have where that's really all that they can expect to get. The other thing that we have started to think about is working with employers to think about how their policies are impacting low-income families. And one of the things that we've heard about is that the impact that a bonus can have on somebody's income. So bonuses show up as income in tax forms that are often used for that redetermination, but it's a one-time payment. And so it can make the person's income look artificially large. And so one of the things that employers can do could be as simple as, instead of giving someone, say, $100 at Thanksgiving, they can pay for their turkey for their family that doesn't count as income and so wouldn't impact those benefits. We also hear from a lot of low-income families about challenges of not having a steady income. So, for example, if someone is owed child support payments, but those child support payments come inconsistently, if they happen to receive a child support payment at the time when they're facing redetermination, it can mean that they no longer qualify for benefits, and make it really challenging for them. But again, their income looks artificially higher at a certain point. So there are policy implications here of changing how redetermination happens, changing how benefits might be designed, and then figuring out what are those things that can help people make ends meet. And I'm sure many of you have received calls from people that have received raises. It means they no longer qualify for a certain benefit, and they're trying to figure out what they can do in order to make up the difference in their family's circumstance. And so I'd love to hear from any of you if you've heard that from people, and kind of what things you might suggest to try and help somebody through that situation. So at this point, I'm going to stop and see what questions and what discussion we might be able to have.
This is Darlene. I have a quick question. I typed it in there a minute ago. I don't recall what you were sharing. What happens with the money left over each month? What was that as we go through the chart? Could you just remind me so that I can think in a complete thought? Thank you.
Absolutely. Yeah, that's a great question. Thank you. Yes. So the money left over each month, they're doing basically whatever they want with it. This could be money that they use to buy a birthday cake for their kid, for example, to pay for some of the expenses that we don't have in the model, to pay for some of those school supplies or educational expenses. They could be saving it. They could be spending it on Netflix or on cable or cell phone. It's just kind of really up to them. It's just what they have left over after they meet all of their basic expenses.
And another quick question. Your chart went increasingly up in income. What's the time frame that you were thinking when you're putting this chart together, that someone started at $8 and ended with $26? What time frame are you thinking of these families?
Yeah, so as you know, the time frame, it's going to be long. I mean, to make that jump is definitely going to require some serious additional education or credentials. And so it will probably take a family years in order to move up that amount. I mean, I think kind of perhaps one useful way to think about it is think about where the family starts and what those close, the kind of close increases might be for them. We created these.
Oh, go ahead.
No, go ahead.
I was just going to say, are there any statistics showing in a poor family's chart, like realistically, where does that income actually end? I mean, I can't imagine everyone who is low income eventually getting to that point. I don't know that for sure, but I just want to know if you have statistics showing, realistically, are there true families that are low income that do start off at that very bottom realm and then, get up? Is there a statistics out there that you're going with?
Yeah, that's a great question. So I don't have statistics and don't have that information, but it's something that I definitely want to look into, and maybe we can do a blog post about it, looking at that. I mean, we know that there are issues with economic mobility in this country, that, people that start out at the bottom, they start out in the bottom fifth, their chances of getting to the top fifth are low. And there are recent studies that found that it's especially difficult for men of color to make those changes, even if they don't start out at the very bottom. But yeah, that's interesting. And I would echo, my impression is what you stated as well, is that it's very difficult for families to make those big leaps. And so probably people that are starting out at low income, unless they're early in their careers and young and going to college and moving on to a different career path, that's what it's going to take in order for them to move up to the very top of the model. I did want to say that we created it in this way because one of our goals is to share this information with policymakers and help policymakers think about how benefits are designed and what might really be able to help low-income families. And so we wanted to present kind of the full picture and make the point to some policymakers that it's not just very low-income people that are encountering cliffs. You know, you can be pretty high in income and still have these circumstances impact you. So thank you for those questions.
Okay, thank you.
Anyone else have any questions or comments? If you don't want to speak up, feel free to put them in the chat. I'm looking at it now.
Hi, can you hear me?
Oh, go ahead, Autumn.
Oh, sorry. No, I was just wondering if we could be able, like, where would we go to find this information, like these graphs and stuff you've shown us, like, or a copy of this PowerPoint?
Yes, so they are posted on our website
Okay.
at communitysolutions.com.
Okay, thank you.
And I think they're under the events tab. And what I can do, Molly, if it's okay with you, I can send you that link after the webinar that, you know, so people can get right there if they're interested.
Perfect. Sounds good.
Thank you.
Sure.
I have another question. This is Darlene. Does any of this or any thoughts that you guys have work with families on budgeting as well? Or focus on that, like what families are doing with their monies as a budgeting kind of thought?
Yes, we have not gone there with this information to help families with budgeting, but that is a very important component in all of this. Yeah.
Thank you.
Mm-hmm. And I think I heard someone jump in to start another question.
Yeah, the only thing I was thinking is that, you know, I think that the Medicaid gap in your chart is the one that's really the most understated. A couple reasons. First is the assumption that an employer is going to provide health insurance at the salary rates that you're talking about is often not the case. And secondly, when that does happen, Medicaid often will pay more in benefits than the plans they get, which means their medical expenses go up. So that Medicaid gap, I think, is usually a lot more severe than your chart would indicate.
Yeah, thank you for that feedback. That certainly makes sense. And, you know, our chart is only looking at those insurance premiums. We haven't looked at those out-of-pocket medical expenses for co-pays or for prescriptions or really for anything. So I think you're probably right that it is understated. And it's, you know, the interesting thing is that people tend to get kind of the food stamp gap, but they tend to not think about the importance of Medicaid in helping families make ends meet, and you know the detrimental effect that not having insurance can have, and the incredible expense that is for all families, but also for low-income families. So I really appreciate that comment. So what other wheels have we gotten turning, so to speak, here in your minds? What kind of, are there ways that you think about how this might impact the work that you're doing, or are there things that you've heard from people that are calling in that might either confirm or deny some of the things that we've shared?
Well, the majority of the people that call us, this is Cam, are in the lower bracket. You know, we have no way of knowing statistics on the individuals, but we have so many people call in for subsidized housing and for food assistance, and people that don't have child care costs paid, the ones that are trying to go and get employment for interviews and there's no child care assistance for that until they actually start the job.
Mm-hmm.
A lot of pockets. So the ones that you're talking about that are moving up like that, you know, it may not be constantly moving. It may stop and start as you go along, but Um, I think it'd be interesting, and I don't know if we would ever be able to do it here, but if we had one other question, we would ask people, especially if they have children. In this particular case, it seems more important to know if they are going to school or intending to go to school. That statistic might help your information and ours to know more about how to help. And that budgeting element, we have agencies in our records that help people with that. And we offer that especially during the tax season as an extra thing to offer them for free taxes and going to help with budgeting. Most people decline that, and I don't know if they ever call back. I've never gotten a call back on that specifically. So I think putting out information, engaging other agencies can help people be more aware that that's so important. And I know that we had something with the Salvation Army where they were offering self-sufficiency coaching. I don't see that in our records anymore. So, you know, I'm kind of tagging on to one of the other comments that was made by someone else. It might have been Darlene on that. So that's my comments on this.
Yeah, we have a separate project that Community Solutions is working on. We're working with Youth Opportunities Unlimited to pull together some data and information that they collected. And one of the things they did is they interviewed youth that are not in school and either not employed or employed part-time, and asked them kind of what career path are you thinking and how are you going to get there? And what they found is that there's a lot of disconnects. Like people don't know what they need to do in order to reach their career aspirations. So that'll be coming out probably in the next month or two and may include some of that information. But that, I mean, if someone decides to go to school, they're probably shifting back, right, on this kind of move up. They aren't moving constantly up because they need to take the time to go to school, and that's difficult to do when somebody's working full time, especially you know, a lot of these people probably don't have regular schedules if they're working for low wages. Thank you very much for those comments.
And the other thing about going to school is that then increases their childcare costs because somebody's got to stay with the kids while they're in school unless they're doing something online. So it's almost a catch-22. They very likely are not able to do it because who's going to watch the kids if you've got a one-parent family?
Absolutely.
And the piece to me that gets scary, and I actually know the daughter of a friend of mine who was in this exact situation, and she does turn down promotions, and she took a promotion with the agreement that they would not increase her salary because she was going to lose the medical benefits and could not afford to purchase them for either herself or her child, and paid the penalty, you know, on the taxes, the whole thing. But you get worried about how careful are they being about selecting a child care provider who probably isn't certified, is doing it under the table, and you know, how safe is that for the child?
Yeah, definitely. I mean, and there's so much work being done in this community about high quality childcare and making sure that the pre-4 CLE and making sure that children are in, you know, appropriate high quality childcare that's setting them up well for future success, and the importance of that. And you're exactly right. I mean, there are expenses that come along with that, and sometimes the more convenient thing to do and the less expensive thing to do is to have a neighbor or someone just watch the kids. So yeah, you know, and when you think about things like that, you can see why we're in a situation where we have generational poverty, because it's really a challenge, and these parents are most likely trying to do what's best for their children, but their choices are really limited in a practical sense. All right, any other kind of comments, questions, anything else I can share that you'd like to talk about?
Yes, this is Tracy. I wanted to add a little bit about what Dave was talking about earlier with the medical coverage. But in the aspect of those that are out, they're not eligible for Medicaid anymore. Perhaps they're either in the marketplace or maybe their employer offers their insurance. But I find that a lot of our callers will not want to seek medical attention because they can't afford co-pays, or maybe their employer's insurance, their deductible is so high that they're avoiding getting the proper medical care that they need. Thankfully, there's resources out there for prescription coverage. There's pharmaceutical programs, there's discount programs, but just seeking the medical care can really increase expenses and change your decision on how you're going to take care of yourself health-wise.
Sure. Yeah. We absolutely see that. I mean, there's data out there from the food banks, the Association of Food Banks, talking about something like some huge percentage of people have had to choose between medical care and food over the last year. And so, yeah, that definitely changes the calculations. And it's, a similar situation to the benefit cliff, where what might be the good decision in the short term, so to speak, can have some real long-term consequences. And with health, I mean, we see that time and time again. All right.
Okay. Does anybody have any more questions, comments, concerns?
I have just one question. This is Michelle. Now, when we were looking at child care, a lot of low-income parents have jobs that are in non-traditional hours. So when we think about child care, we always think about it in that 8 to 5 or 8 to 6 range. Is any of this data that you're collecting being used to just kind of look at that to see if maybe there can be some more options for child care, like second shift or third shift options? Because again, I think we just kind of think that child care is only between the hours of 6 and 6:30.
Mhm. Yeah, I mean that is a real challenge for so many families. And like I said, we assumed that a family would be able to find suitable childcare that meets their needs, where they can use a voucher, and we know that those things are few and far between and difficult to find in this community and in communities across the country. So, I mean, that is something that we're working with partners to talk about and think about, and just kind of share with policymakers and with others the realities of what low-income people are facing, and that the system doesn't always work the way that you would want it designed, and that people don't always fit that kind of standard 9 to 5, child care situation. So yeah, I mean, I don't have any good solutions to that issue, but we know that it is something that is a real concern.
Okay. Well, I want to thank Emily for her presentation. It was very insightful. And I am going to go ahead and move on with the next part of the webinar. Emily, you're welcome to stay, but don't feel like you have to, because this is more about internal policies and procedures that I'm going to go over now. And then I'll talk to you later.
All right. Thank you.
Okay.
And thank you all for your comments and attention.
Thank you, Emily.
Thank you, Emily.
Thank you.
All right. Okay. Oh no, did I? Oh, here it is. Okay. All right. So moving on to the brief check-ins portion of our webinar. Quality assurance. So QA is going to officially start back up on July 1st. Currently, Stan is performing QA right now as a 1-month pilot to get a sense of how many calls per specialist that he can realistically review. And there's still a few score buddy issues that we're trying to get ironed out. So the official relaunch of quality assurance will be on July 1st. Okay. Next, points of contact. So I'm going to be sending out a new, slightly updated copy of our points of contact policy. Now, we understand that it can take a really long time sometimes for those calls to the supervisor line to roll from phone to phone. And currently we're working with Verizon to look at some options to increase efficiency. So just a reminder that your call to the supervisor line is not completed until you hear Diane's voicemail pick up. So if the line is ringing and it's taking a long time for somebody to answer, it just means that the calls are rolling from cell phone to cell phone. So don't hang up and try to call back again. Just allow the phone system to ring through phone to phone to phone, and then whatever supervisor is available will answer and help you. Or if no one's available, you'll get Diane's voicemail, and someone will get back with you shortly. Now, I want to remind everybody that the supervisor line is only staffed Monday through Friday, 7:30 a.m. until 6 p.m. So what that means is there are only supervisors working between those hours. Now, that's not to say that you can't use the supervisor line for urgent situations, but please, outside of those hours, use the line only for urgent situations. So if it has to do with a time off request, or you have a question about a policy, or you're concerned about QA, or it's some other non-urgent situation, please refrain from calling outside of those hours. You can send an email or call during those regular business hours. I just want to remind you that our supervisors are human beings outside of working hours, and so they deserve to have a break just as much as you and I do. So just please be mindful when calling that number. So outside of that 7:30 a.m. to 6 p.m. Monday through Friday, if you have a situation where you have some questions or concerns about, but it's not really urgent, then you can save a follow-up for the supervisor in Refer. So just a reminder here, I'm in Refer, and I have a caller with a situation, and I'm not really sure how to handle it, but it's not urgent because the agency's not open, or the need just isn't terribly urgent, and it could be handled during regular business hours. You want to make sure you save your follow-up, and under this staff assigned to, you're going to choose 211 supervisor. That account is monitored during those business hours, 7:30 a.m. to 6 p.m. Monday through Friday, and either your assigned supervisor will respond, or they will delegate somebody to respond for you. Or you can save a follow-up for yourself and email 211 supervisor for some guidance. So if you are working either the next day or within the next few days, and you're able to do that follow-up on your own, go ahead and save it to yourself. If you're not working for several days, save the follow-up to 211 supervisor, and then and someone will handle that for you. Okay. Lyft. So everybody's doing a great job with Lyft. So far, Chris just checked and earlier this morning, and at that point we had scheduled 30 rides already. Well, we've completed 30 rides already, so so that's great. Just a reminder that you cannot pre-schedule a ride for somebody if they do not have a cell phone. And reason for that is that Lyft sends a text with identifying driver information to the phone number that we put in that portal. And that what shows up on that text is the driver's name and the make, model, and color of the car. So just make sure if somebody does not have a cell phone, then they're going to have to call at the time that they need the ride. We wouldn't be able to pre-schedule it. If somebody calls without a cell phone, then you want to stay in the Lyft portal until that above information displays, and you can relay it to the caller so that they know the name of the driver and the make and model of the car that they're looking for. And then don't forget, we've had a few folks forget this, don't forget to put the refer transaction number in the internal note field in the Lyft portal. So by refer transaction number, I'm talking about this number up here in the upper right-hand corner of the screen. Please put that in the internal note section in the Lyft portal so that we can match that ride with the transaction and refer. Okay. So just calling other agencies. So there have been an increase, there's been an increase in the number of emails from navigation specialists who have taken calls from agencies that need to make a change in their listings. When this happens, please send a transmittal and let the caller know that somebody's going to be contacting them soon. So previously the policy had been to transfer the call to Mike Quigley. However, with him transitioning into working remotely, that might not be the most efficient way. So it's been decided that if you have an agency on the phone and they need to make a change in their file in refer, please send a transmittal and someone will contact them as soon as possible. And just a reminder, those transmittals are monitored the same during the same hours as the supervisor line is available. So 7:30 a.m. until 6 p.m. Monday through Friday, there would be somebody monitoring that account who would be able to handle that request or forward it to the correct researcher. If a caller tells you that information in our database is incorrect or inaccurate, please don't forget, send a transmittal. Don't call the agency yourself. Our resource team members, each of them have established relationships with the agencies in our database. And so it really, please leave that job up to them. And so they will reach out, whichever researcher is handling that particular agency will reach out to the agency in order to make any necessary changes. It just adds to confusion as well when the research team has to call an agency and that agency is like, well, I just talked to somebody else the other day. Just leave that agency contact for the resource department. And if you're really concerned about it, you can always offer to follow up with the caller after resource touches base with the agency and replies to your transmittal. If you want to call that caller back and relay whatever it is that we discover, then that would be fine. Okay, performance reviews. They're coming up. So navigation specialists, check your schedule in NICE IEX to find out when yours is going to take place. And if you don't see anything on your schedule, your supervisor will be reaching out to you about when that's going to happen. Okay, accountable health communities. So we're rolling out accountable health communities program very, very soon. The St. Vincent Charity Hospital Psychiatric Unit is going to be the first location to have an AHC navigation specialist on site. I don't know exactly what the date is, but it's going to be in approximately 1 week, give or take a little bit. The other locations are going to be at the South Point ER and a few different departments at Metro Health. There'll be internal medicine, mother and baby, and the cardio units. And those locations are going to be rolled out one by one after at some point after St. Vincent is rolled out. So all of these clinical sites are going to have AHC navigation specialists on site by August 1st. Now, there are still positions available, so if you know any qualified potential candidates, please refer them to the United Way website in order to apply, unitedwaycleveland.org. And since our last staff meeting, we've had several new staff members start. With the accountable health communities, we have Edwin, Donna, Marisa, and Caitlin. So welcome them. And with 211, we have Nisa and Shara, which not Sheree, it's Shara, so a little confusing because we've got a Shara and a Sheree spelled the same way, but it's Shara. Both of them are part-time remote. Nisa will be working during the day. Shara will be working evenings, weekends, and holidays. And then starting next week, we also have Abby, who will be working on-site full-time, the 9:30 to 6 p.m. shift. And again, we are still hiring. So if you know any experienced professionals who may be interested, please direct them to the United Way website in order to apply. And that's the end of my presentation, so feel free to clap. Does anybody have any questions, comments, concerns about any of those check-ins?
This is Darlene. I have a quick question. For the reviews that we're going to be doing, you may have already sent, but I'm just curious, is there something in my email that is going to go over what we're going to be reviewed? I always forget by the time I get there, and I just want to make sure I plan accordingly, some of the questions and some of my thoughts, but I just wanted to know if you had an email that you guys actually have a checkoff list of what we will be going over at those reviews.
I don't have a document right now.
Is it just basically the performances that we've done in the past? So if we have one here, that's basically what this is going to be about, correct?
It's going to be similar to that, yeah. So, your quality assurance scores, your adherence, your participation in the webinars, the caller feedback, all of those things, any of those metrics are going to be reviewed with you.
Reviewed. Okay, thank you.
Yeah. Yep.
Molly, it's Suzanne.
Hey, Suzanne.
I just wanted to clarify over those transmittals for when an agency calls in and needs to change something. So I know that in refer, you can't send a transmittal unless you save a referral.
Mm-hmm.
So we're basically doing the email still to 211 update.
Mm-hmm.
Or are we saving a referral to that agency that's calling in?
You will, hold on a second. I'll show you.
Because that's what I think of, even though it is a transmittal, I still have to do it via email.
Mm-hmm. Yeah, the transmittals are via email. Give me just 1 second here.
Sure.
I'm trying to find something. Okay. All right. So if it is just an agency that's calling and saying, "Hey, I need to, we need to change our information, update something, and refer," you are going to you do a taxonomy search, comprehensive information and referral.
Okay.
Bring us up here.
Mm-hmm.
All right. And then go to save reason. And then in save reason, service site resource update.
Okay.
So you're saving doing a save reason to us, service site resource update. You'll have to do, in order to send the transmittal out of refer, you do have to save a referral to whatever agency it is. So let's just say it's, if you wanted to send a transmittal here about Asian Services in Action, you do have to save the referral and then go back in order to send that transmittal.
Okay, so you want us to do that even if that's agency that's calling in? I mean, because we're not really referring to them, so I'm just double checking.
Yeah, well, you have to save the referral in order to send a transmittal. Otherwise, it won't send through refer.
Right, and I know in the past I thought we were supposed to then you go to your email and send an email to 211 updates if that was the case.
Okay.
Because if you're not really referring, but there's an issue with that agency that you found out something was wrong, I mean, it's just wrong data,
yeah,
right?
No, I see what you're saying. You could go into the contact activity and delete that referral then.
Afterwards?
So that you're still able to save it so that you're still able to send that transmittal through refer. You can save the referral, send the transmittal, and then go into your contact activity and delete that referral if it wasn't a situation where you would really appropriately need to save a referral there.
Okay, great. Okay.
Yep.
Okay.
This is Darlene again. Real quick, Molly, can you remind me why we are sending the 211 updates versus what you just did there with the transmittal on in refer? Like, why would we choose one option over the other? Just because sometimes I do one, sometimes I do the other, and I just want to be clear that I'm doing it right.
Well,
or the way you guys prefer.
Any email, all the transmittals that's where they're sent. They're sent to 211 updates.
Okay.
So if you go and you select this email template, that's what's coming up. So, I mean, either way, it's going to the same email address. It just makes it easier for the researcher when you send it out of refer, because then they know exactly what program that you're talking about. I mean, I could certainly send them an email from Outlook to 211 updates, but then they're not going to have that benefit of knowing necessarily exactly what I'm talking about.
Got it.
So they're able to see exactly, they're able to see exactly what you're seeing when they look at that email, and they'll know right away whatever it is that you're talking about. So you might say, oh, my caller said that instead of opening up at 8:30, they're now opening up at 9. They'll be able to look at that and see right away, oh, yeah, it does say in here that the service hours are 8. It gives these service hours. I'm going to contact the agency and move forward with this. So it's really for the benefit of the researcher to see exactly what you're seeing and having it right there without them having to dig through the database and find what it is that you're talking about.
Got it. Thank you. Thank you.
Yep. Okay. Anybody else? Questions, comments, concerns? All right. All right, great. Well, I don't have any sort of shameless plugs this month. Perhaps I'll have some next month. You'll just have to wait and see. But we're going to go ahead and end here unless anybody else has anything to say. I'll give you 30 seconds to pipe up, and then I'm ending the webinar.
Hey, Molly, this is Sharon.
Yeah, hi, Sharon.
Hey, if you have a moment, I'll call you after the this is done. I have a quick question for you.
Oh, okay, sure.
Okay, thanks.
Sure.
Thank you.
All right. Well, thanks, everybody, and enjoy the rest of your day.
Thank you. You too.
Thank you.
Thank you. You too.
Thanks, Molly.